Hi guys, welcome back to my channel, and I am so excited today because we are using world's first smart triple wavelength laser by Soga Oricam at Topazdent today. So let's go and check it out. So this smart laser by Soga Oricam can be used for multiple procedures, as you can see in this menu, and I must say that this laser is one of the most beautiful looking laser I have ever seen for the respect of a diode laser. So let's check out the menus. Let's go into Endodontics. So it says that it can do germ reduction, and it has shown that these type of diameters of fibers can be used in this. So it is truly a smart laser because it is telling the doctor how and what type of laser can be tip can be used for this. So let's confirm this, and then it goes on to the main menu, and the main menu for a particular procedure, like let's say endo disinfection, it shows us that this laser that is being used for this is 980 nanometer wavelength, and also the type of fiber, which is F2 series, and the diameter would be 200 nanometer, and also the laser suggests that it should be used at 1 watt, and the energy that is being dissipated at that time is 30, and average power would be 1, that would be coming out of the laser tip, and also it would be going on for 30 seconds, and this shows that the aiming beam is ready. And also this shows that it can be used for different modes, as in if you want a continuous mode, or if you want if you want it to be limited to pulsed mode, and you can choose the amount of pulses that you want to use with the laser. And when we press ready, the laser is ready to be used, as you can see this, and then we can use this handpiece from where the laser would be coming into the fiber. And also the fiber that are being given by the company are multiple, so I'll be showing you that after this. Now let's go back into the main menu. Okay, so we have to get the laser on standby, and then we can go into the main menu. So let's go into the perio menu. Now again it shows that we can do perio germ reduction with 980 nanometer wavelength, and it also shows the type of fibers we can use with this laser and the length of it as well. So you can choose the type of fiber and the length according to the pocket length as that is present in the patient. So let's say we have put this fiber, and we'll confirm this. Now as you can see in the menu in perio, it shows that again 980 nanometer wavelength is being used with this laser, and F4 fiber is being used, and again it is showing that 1 watt wavelength should be used for this. And also, if you can observe on the screen, we have 2 more wavelengths which can be used for different procedures, but right now 980 nanometer is being used for this procedure. Again, the energy is 9, and average power that would be coming out would be 30, and also the time would be 30 seconds. So, and we can increase the time according to our liking, or actually the amount of procedure that is to be done, and the amount of energy that is required. So as you can see, when we increase the time, the energy is increasing over here. Okay, and also I would like to do it in continuous mode, so I have put it in continuous mode. Now let's make it ready, and the laser would be ready to be used for perio disinfection. Now going on to let's put the laser on standby again, and go on to the main menu back. Let's see what is there in the desensitization one. So here we have 2 options, as you can see: desensitization with 980 nanometer wavelength, and desensitization to hot and cold teeth with 650 nanometer, and to desensitization with 650 nanometer. So let's choose the first option first. Like in all other options, it showed us the fiber and the length, so you can choose it, and also you have to confirm after that, and you can see that the laser is already fed with the wattage that is required and the energy required. Now if you want to do it for more times, I usually prefer it for 1 minute. So I'll increase it to that, and also the treatment energy increases alongside. And of course I have used it for a continuous mode, so I'll make the laser ready and again use it for the procedure that I want to use. Now again I'll get it back to the main menu. First I have to go on standby and then I'll go on the main menu. Now again I want to do desensitization. I want to try it with 650 nanometer wavelength. So for this it is showing us that we have to use a different tip, and for that all these tips are being used on this area when we remove this. So this gives us an option of putting a fiber or a tip like that is being shown on the screen. So it is smart, like they say, because it is also showing you the kind of tip that has to be used with different wavelengths and different procedures. Okay, now going on to different menu. Like here, if you can see now, the wavelength has been changed over here and also the fiber has been changed. And with this wavelength, it says that we should use only 0.2 watt and the total energy required is 6 and the timing that they are suggesting is 30. And also the laser is being used for continuous mode. So let's, if we'll make it ready, then again you just have to take this, put the handpiece and aim it on the tooth surface for 30 seconds or 1 minute, and then you can decrease the hot and cold sensitivity in the teeth. Now let's go back to the menu. Let's going on to desensitization again. Again it is showing us tooth desensitization, third option 650. Again it is showing us a different tip. Now I'll be showing you tips after we explore the menu over here. Now going back to the main menu, let's go on to implants, because implants is something which is being used regularly these days, and with this we can do treatment of peri-implantitis, that is infection around the implant and inflammation as well. Now for this we have to put a different tip, and also the diameter and the length has been suggested by the laser. So let's confirm this, and also let's see over here, it shows us the procedure, the wavelength and the tip that has to be used over here. Now personally I use it for 1 minute, all the procedures for disinfection, so I'll increase it over here, and you can see that the treatment energy is being changing over here as well. Now here they have suggested a pulse mode, but I like to do it in continuous mode because the amount of energy that we are using over here and the wattage is quite less. But then it is, every laser dentist has their own perspective about different kind of procedures. So this is my perspective, and anyone else can have their own. But ideally, according to my knowledge, this should be done. Now going on to the menu backwards. Now coming to the hot topic, which is tooth whitening, because a lot of people are getting tooth whitening these days. It's an aesthetic procedure, it's wonderful and gives amazing results as compared to other lasers, other regular procedure, because the normal tooth whitening or bleaching causes a lot of sensitivity of teeth, because it removes a lot of mineral content from the tooth surface, which is a problem for a lot of people. They get a lot of sensitivity, so you have to treat that after whitening. But with laser you don't have any problem like that. You have faster results, you have less or minimal sensitivity, and there is very less loss of mineral content from the tooth structure. So it's a win-win situation. So let's go into the menu for tooth whitening. We have 2 of them. So let's see. Now they have given a different tip for tooth whitening, and I'll show you all these tips for this. Now, so this is the tip for tooth whitening, and it can be used to do whitening in multiple teeth. And I must say again, it's a beautiful handpiece. So I'll confirm this again, and after confirming this, I go into this menu. It says 1 watt, and this is the energy in 30 seconds. Now I'm going to change this because I'm going to do multiple procedures. Now wattage and amount of energy dissipated has to be decided by the clinician, and but it can be suggested by a machine, but it is purely your judgment and your knowledge about the procedure. So I'll take it to 3 watts because that gives us the best results according to my case studies. And also I will increase this time frame to 2 minutes. So when we increase this to 2 minutes, the energy goes on to let me just go on to 2 minutes. Yeah, so we have touched 2 minutes now. Okay, so the total energy that is being dissipated is 360, and average power that would be coming out of the fiber tip would be 3. Okay, now going on to the procedure. Now what you have to do is again get the laser ready, and you have to press it, just show it on patient's tooth and leave it for 2 seconds and leave it for 2 minutes, and after 2 minutes remove the fiber, remove the laser and also remove the bleaching agent, and you'll get amazing results. Now going on to, let's say, okay, this laser is ready. I'll have to put it on standby. Now going on to tooth whitening again, let's see what happens with 450 nanometer. This is the first time I've seen a suggestion of 450 nanometer for tooth whitening in this laser. Now again, it is showing us that we have to use this bleaching handpiece only for doing teeth whitening. So we have already put in, and let's confirm this and let's see what happens. Now like I have already showed you, for 450 nanometers they are suggesting 3 watt laser. Now there different kind of populations in the world have different wavelengths and wattages that are ideal for teeth whitening in different countries. So according to Indian population, I use it at 3 watt for 2 minutes. Yeah. So now let's go on to a different menu. Let's say go on to surgery. So they have different multiple procedures, that is hemostasis, gingival sloughing, implant exposure, sulcular debridement, pulpotomy, gingivoplasty, angioma, frenectomy, removal of labial and sublingual tissue, removal of epilis, removal of fibroma tissue, and gingivectomy. Let's go on to the next page. And also, if you can notice, they have suggested that which wavelength will be used for this. The upper ones have 980 and the lower ones have 450 nanometer wavelength. Let's go on to the second page. Now it shows that exposure of implant during second stage can be done, and gingival troughing for crown impression and hemostasis as well. Okay, now besides this, a lot of surgical procedures can be done with the same menu if you know your laser properly. So let's go on to one of the procedures. I'll show you 2 of them, one for 980 and the other one for 450. Okay, so we have, now it says that we have to use 450 F4 series, that is recommended for this procedure. Okay, so now I'm going to change this tip to the surgical. Okay, so now I've put this color coded tip, which is PF4 as you can see, and I actually have to say that they have used amazing colors and the user interface is amazing. So let's confirm this, and now it is showing us that gingival troughing can be done with 980 nanometer laser and PF4 fiber, which we have already put, and at 1.5 watt. So it makes it easier for the user to use the laser even when you don't know the physics too much. So they have made it very easy to use. Now let's go into the menu and see for, let's say, the fibroma for 450 nanometer. Now for me, as you can see, it is showing us that the color of the fiber is changed and the diameter as well, and the length also they have suggested. So let me just change that. Okay, so now we have shifted to the yellow fiber again from F4 series, and also now this laser can be used for the procedure that we have chosen. Now as you can see, when we go into the lower wavelength lasers, the wattage that is required to do a procedure increases, and here it is showing us continuous mode because obviously the wattage, the energy that is coming out with larger wattage as well is less, so we can use it on continuous mode. But if you see that while doing the procedure you are having a lot of charring, then you can decrease it to pulsed mode. Okay. Now again, to start the laser, you just have to put ready and also start with pressing the laser activation button. Okay, now let's go back to the main menu. So we have seen endodontics, periodontics, desensitization, peri-implantitis, tooth whitening and all types of surgical procedure. Now let's go on to the treatment for herpes and abscess ulcer or abscess, cyst, and establish a drainage path. So all these procedures can also be done in this with this laser. Now all these procedures, they have suggested that it can be done with 980 nanometer diode laser. Okay, now let me select the abscess ulcer option. Now it is showing me the same fiber, yellow one, and we can use it with the same wavelength. Now as you can see, they have suggested the power and the wattage that can be used with each and every procedure, and so you can see also they have suggested the time frame for which we can use the laser for performing abscess ulcer treatment. So this is absolutely wonderful, and let me go on to the main menu for other procedures as well. Let's see what we can do. Now as you can see, for the abscess ulcer, for the abscess drainage, they have suggested again a purple tip, because obviously the diameter of the tip is different. Okay, so let's go on to, as you can see, now it shows that the wattage has been changed and the time frame also has been changed. So alongside this, showing you everything, how you have to use, what type of fiber you have to use, and how much time it is required, what would be the average wattage in each and every procedure. Now let's go on to the biomodulation. Now biomodulation is really wonderful because it is helpful in procedures day in and out. So it promotes pain therapy, as in it reduces pain in different forms. It can be related to your TMJ, and also it can be used for biopsies, and also for promoting wound healing and relieving the burning mouth syndrome. Now here they have used all three types of wavelengths for different procedures. Now again, for these procedures, mostly this biomodulation tip is being used. So this is the biomodulation handpiece that they have provided. Actually, I would say that this is a complete laser in which they have provided all types of tips, bleaching handpiece and biomodulation handpiece as well. So let's confirm this and see, it is showing us the wattage that can be used for promoting wound healing and the treatment energy that is required with this. So you just have to take this and show it on the tissue that you require for wound healing. Yeah. Now going back to the main menu, let's see what happens when we choose relieve burning. Now for all these menus, same type of biomodulation handpiece is being used, and you have to direct it at that area 3 to 4 mm away from the surface for 1 minute, and you can do multiple cycles for this. That's how it is being used for relieving burning mouth syndrome. Now the other procedures also are done in the same manner. Let's go back to the main menu, and now this is my favorite part. It shows user defined scheme. So according to me, like if I know my laser, I can do any procedure from any menu, but they have specially designed this custom mode wherein you can choose different kind of procedures. If something is not there in the menu, you can add it over here and you can just select it and save it according to yourself. Let's say I want to increase or decrease the wattage, treatment energy, time frame, and I want to do a procedure which is not usually in the main menu, so I can modify according to myself. This is a really wonderful feature of this laser. Now going into the main menu, so for user defined, they have given us 5 options, and I can put and rename these as well. Okay, now so this was the interface of the laser and the procedure that can be done, and different kinds of tips and biomodulation handpiece and bleaching handpiece that are they providing, and along with that laser is coming with protective mechanism. It is very important for using a laser. Now it is an option whenever laser is in use. In fact, it is not an option, it's compulsory that no one should enter without eyewear when laser is in use. So in case if something like that happens, or if there's some problem that you see in the machine or somewhere around you, so you can just use this, and it says that emergency protection state available after restart. So you can use it and you can stop the laser will stop on itself. Also, I would suggest that whenever you have a laser, you should be having a stick or a light which glows when you are performing a laser procedure, which tells the person who is inside that it's not safe to come inside without wearing eyewear and proper protection. Okay. So the company is providing eyewear to protect any retinal damage while using this laser, and as you can see they have mentioned that it can be used for lasers ranging between 340 nanometer to 1064 nanometer, and these lasers I have used, these eyewear I have used them. They're pretty comfortable and they actually cover the whole area of the eye so that no ray can go inside from anywhere. As you can see, this is properly protected from everywhere. And also whosoever is using a laser, always see that the type of laser or the wavelength that you are using have an eyewear which is protecting them from that particular type of wavelength. See, if you use these lasers for wavelengths above 1064 nanometer, then obviously your eyes are going to be damaged, because these eyewear do not have that much of protection from high wavelengths. So now, but they have provided us two eyewear which has to be worn by operator and an assistant, and also one eye cover for the patient so that there is no retinal damage to the patient as well. Now this was about the functioning of the laser, and according to me, if you ask me, it's really nice and wonderful, and it is truly smart in all senses. And I think this has the potential to take over the laser market that is there in India right now, because smart is something that people are looking at. So good job Soga Oricam, and I'm looking forward to do more procedures with this laser. So that was about the first world's smartest laser, and I'm really excited to use it more in the clinic. And also we are always welcoming new technology at the clinic. So stay tuned for more updates, and if you like this video, please like it and share it, and subscribe to the channel and hit the bell icon for latest updates.